before the CDC put out its guidelines on what to do when you do get vaccinated. WMAR2 News asked the leading expert on infectious diseases at GBMC those same questions. Megan Knight has that part of the story this morning. Good morning, Megan.
Good morning, Christian. Yeah, and in my conversation with Dr. Theodore Bailey from GBMC, my biggest takeaway from that was what the virus does all depends on what we do. So he says if we continue for right now to wear our masks and maintain social distancing, especially out in public, while we wait for more people to get the opportunity to get the vaccine, that will drive the number of COVID-19 cases down even more. But if we abandon those practices too soon, those numbers could go back up. Now, Dr. Bailey says what's important to understand about the vaccine is while their efficacy rate is high when it comes to preventing serious illness, hospitalization, and death from the COVID-19, it's not 100% perfect. So even once you get the vaccine, there is still a very small chance that you could get it or pass it along to someone else, which is why for right now, keeping these safety practices in place is ideal, again, until more people can get the vaccine. I also asked Dr. Bailey about whether it's a good idea for people to gather who have all received the vaccine, and the CDC says that those who have been fully vaccinated can gather inside in small groups without masks or social distancing. Here's what Dr. Bailey had to say about that.
I would ideally, feel more comfortable going to hang out with friends, all vaccinated, but keeping some distance in those settings, is outdoors as much as possible. The spring is coming. This is not Game of Thrones. It's not winter is coming. It's spring is coming. And we have to think, let's do as much as we can outside. Let's keep our risks as low, drive the numbers lower, and really look forward to being able to open up for everybody as 2021 keeps going.
Yeah, certainly going to be a great week to go outside and see some friends and family. Now, another question is, how long does the immunity last once you do get the vaccine? And Dr. Bailey says that is still being studied right now. People who were part of the clinical trials from the very beginning, they're still being monitored today. So right now it's not clear exactly how long the immunity lasts, especially as new variants of the virus are popping up. But Dr. Bailey says the good news with that is that we know that we can vaccinate against COVID-19. So scientists can use the same methods that they did before to try to combat these new variants that are popping up, kind of like what we do with the flu shot each and every year. So bottom line message from Dr. Bailey is to get the flu or get the COVID-19 vaccine when you can, when it's available, and when you're eligible, so we can start to stay on track to get back to life pre-pandemic. We're live at the Inner Harbor. I'm Megan Knight, WMAR2 News.